Back in US, people have big setups, and many of them can they work together. And what we have that is wonderful, and which is definitely not available back there, is affordability. If I just give one single shout out to the rescuers, I'm associated with a lot of rescue groups. If I give one single shout out to them कि यार मुझे ना सारे 8 साल से ऊंचे के सब डॉग्स लेके आओ, मुझे कार्डियक इवैल्यूएशन करना है, एक दिन में मेरे पास 25 आ जाएंगे.
Ma'am, going to the topic of the day, which is cardiology. So, can you just briefly explain what cardiology in pets is, like what this topic is about today?
So, cardio means heart. Any ology means science. So, it is the science of studying heart. We all know no heart, no existence. It's that critical science, okay? And in before, whenever we say about heart, see, मेरे पास ना people come down from other clinics as a referral patients. Mostly, my clinic is most like a referral clinic. So when they come down from the other clinics, you will not imagine, Yash, the people are so scared. क्या बोले कि मैम क्या diagnose होगा, क्या हुआ है मेरा puppy को? See, their fears, their the stress and the level of exhaustion in them is so high. So before getting into the topic, I'm just thinking, I'm sitting right in front of a pet parent and you're questioning me. I would like to handle it that way. So let me tell you right away, in pets do not go through a heart attack. Zero. कोई heart attack नहीं होता है.
Okay.
Humans में होता है.
Right.
Right? 1, 2, 3 heart attack. Have you heard those things?
Yeah.
Dogs do not go through a heart attack. Okay. Very simple logic, I'll tell you. I'll just give me about 5 minutes, I'll explain you. This is heart.
Sure. Yes.
This is heart and this is human heart.
Right.
ये model human heart का है, मुझे animal heart India में मिला नहीं. Now, in science, anything that is red is good. It's more oxygen. Anything that is blue is bad. It means it has less oxygen and all the waste materials. So this pipe is carrying oxygen-rich blood. This pipe is carrying oxygen-poor blood. What is heart? Heart is nothing but a pump.
Correct.
टिल्लू मोटर होता है ना?
Right.
पानी का पंप देखा है? टिल्लू मोटर नीचे वाला संप से ऊपर वाला टांकी में पानी भेजना. That is what is heart doing. But it's working two ways. It's not only sending the blood to the entire body, but also picking up the waste blood from the rest of the body. And that's creating that kind of pressure. All the entire circulation is done by the heart, right? But like any other organ needs blood supply. Any organ needs, right? किसी भी heart को काम करने के लिए, किसी भी organ को काम करने के लिए blood चाहिए. अभी मैं बात कर रही हूँ, आप समझ रहे हो, आप सुन रहे हो, your brain is working, my brain is working. I need that energy in you. Similarly, heart muscles also need energy to work. So if you see here, the tiny blood vessels, which are red in color, so these red blood vessels supply the blood to the heart muscles. The one which are blue in color right next to it, they carry the oxygen used blood off the muscles of the heart and they carry back to the lungs to replenish with the oxygen. ठीक है. Humans में क्या होता है? I don't know if I'm able to show you this, but basically, यहाँ पे है. Basically, there are only 2 major branches.
Right.
So this is the major blood vessel, which carries the oxygen-rich blood. ये blood vessel ऐसे छोटा-छोटा 2 branch निकल रहा है ना? देख रहे हो?
Yeah.
दोनों branch left or right side of the heart को supply करता है. Okay. Now, in humans, if you see कितना कम है ना ये सारा, कितने कम blood vessels है, देखिए आप, इतना place में थोड़ा सा blood. So, if there is any blockade because of the fat accumulation or whatever the crap in the world, अगर मान लीजिए यहाँ पे block होता है, तो ये blood vessel कितना बड़ा एरिया को supply कर रहा है? यहाँ ब्लॉक हो गया तो इतना पूरा एरिया को सप्लाई नहीं है. it means that that part of the heart is not working. It is not pumping. The bigger the part of the heart that's not working, that it will lead to what we call as a myocardial infarct. Don't worry about the name. It just means that utna heart को supply नहीं है, वो काम नहीं कर रहा है, वो मर चुका है. The bigger that area, faster, sooner and powerful is the heart attack. समझ आई बात? मान लीजिए सिमिलरली, मान लीजिए यहाँ पे आके ब्लॉक हुआ है, यहाँ पे चुन्नू सा एरिया, छोटा सा ब्लड, इतना सा ब्लॉक हुआ है. अरे यार पहला अटैक था, छोटा था, कोई बात नहीं, बच गए. यानी कि सिर्फ इतना एरिया है जहाँ पे ब्लड सप्लाई नहीं हुआ है, तो यहाँ पे स्टेंट डालेंगे, फिर सप्लाई हो जाएगा हिस्सा. ठीक है? Now the difference between a pet's heart and a human heart is, if they have these two major blood vessels which are branching only this little, dog's branching is more than 300 times the human branching. Yeah, dog, they are special creatures. ठीक है, तो इस वजह से ऐसी कोई भी छोटी सी जगह नहीं बची है. मान लीजिए कहीं ब्लॉकेट भी हो जाता है ना, इधर ब्लॉक हुआ है तो बाजू वाला आके सप्लाई करेगा, इधर ब्लॉक हुआ है तो इधर वाला आके सप्लाई. It's a huge mesh. It's a huge mesh. That is the reason there is no blockade. Even if the blockades are there, the part of the heart dying not because of zero supply of the blood doesn't happen. That is the reason I say there is no heart attack in the heart. However, if a dog is dying because of the stoppage of the heart, there could be two reasons. One, that there could be some other diseases which might be killing the heart slowly or suddenly, like kidney failures is one major reason.
Okay.
Or secondly, if the heart is failing, it means that so much of reverse flow of blood, there's so much of damage already in the heart कि heart काफी बड़ा हो चुका है, उसका pumping capacity एकदम कम हो गया है, then it will slowly lead to the failure. Lungs पे fluid भर जाता है, पेट में fluid भर जाता है, heart एक bag में होता है, उस bag में भी fluid भर जाता है. So that way, they could be the pet because of the heart itself. But unlike you and me, dogs are blessed people. They do not die because of the heart attack. Okay?
My mind is blown, and I feel that for the questions that I'm going to ask you next,
yes,
it is going to happen again and again, because like, wow, so much information, zero awareness about it. As a pet parent myself also, right? So ma'am, like my first question, like the next question rather to you would be like, what are the most common cardiac conditions that you encounter in pets, and what are the potential causes and symptoms for it?
Okay. So let me again show you back my heart. Heart is an organ of muscle. When I'm opening the heart, there are two sides. This is the left side of the heart. This is the right side of the heart. अभी ये जो क्या है muscle है ना, आपने notice किया?
Yeah.
Right. The left side is very thick. The right side is very thin.
Yes.
You guys do a lot of exercise, muscles develop होता है.
Right,
so,
right.
The left side of the heart is absolutely crucial because it is carrying high amount of oxygen rich blood. So the answer to your question is, what kind of heart diseases occur in animals? Two. One is the disease of the muscle of the heart, and the second important thing is the disease of the valves. If you have ever heard valves, so valves are basically, the heart has two top rooms and two bottom rooms. So basically these valves are like windows. They check the flow of the blood, okay? In unidirection. They try to maintain the unidirection, right? Second disease is the muscle of the heart. So muscle of the heart gets affected, wherein it becomes thinner and thinner. It loses its elasticity to a certain extent. So what will happen is, just imagine a balloon. You inflate, deflate, क्या होगा? खिसक जाएगा, it just loses its elasticity. It becomes flabbier. When it becomes flabbier, it has more volume of air in it. Similarly, there's something you call heart bada ho gaya hai. Heart has got enlarged. This is what happens, okay? Even if the valves go bad, so valves are like this, they open and close, open and close. So when they go bad, basically instead of being flat leaf-like structures, they become laddu. ठीक है? तो कितना भी कोशिश करो, there is no 100% closure. Right? Then what happens? There will be reverse flow of the blood. There will be leakages because आपकी खिड़की जब पूरी बंद नहीं होती है तो leakage होता है. Isn't it?
Right.
Similarly, there will be the leakages of blood, and blood will move in the opposite direction to a certain extent. So bigger the window, bigger the opening, bigger the leakage, right? Similarly, as the मान लीजिए heart के valves अच्छे हैं, but the wall of the heart has gone bad, then what will happen? The heart gets bigger, so there is a space between the valves. No matter how much my heart is beating strong, but because there is a gap, there is a reverse flow of blood again. So whenever there is a reverse flow of blood, basically what happens is the top chambers of the room, the top rooms of the heart basically gets enlarged. They become bigger and bigger. So in top rooms में से blood आपको आ रहा है, left side of the heart में blood आ रहा है lungs से. तो क्या होगा? The blood that is coming from the lungs to the heart, so there, because of the reverse flow, you will see a friction, थोड़ा सा resistance. जैसे मान लीजिए आप एयर कूलर के सामने खड़े हो तो आपको resistance नहीं महसूस होता है. Similarly, the blood flow that is coming from the lungs to the heart, they face the resistance. Why? Because there is already a lot of blood in the lungs, in the heart. तो उसकी वजह से क्या होता है? So the blood stays in the lungs for a longer period of time. Blood lungs में क्यों गया? To replenish the oxygen.
Correct.
इसमें मिलेगा ना oxygen.
Yeah.
I'm breathing in, I'm taking the oxygen. So lungs are supposed to replenish the oxygen, but unfortunately, because of the reverse flow, the blood stays in the lungs for a longer time, and lungs में ना blood vessels बहुत पतला होता है. Very thin blood vessels.
Right.
When there is longer stay, then the water content of the from those blood vessels starts seeping into the air bubbles of the lung. यानी कि धीरे धीरे पानी बाहर जाने लगता है, lungs में आने लगता है, and that is what we call as a congestion. जुकाम हो जाए तो lungs में COVID में congestion नहीं होता?
Yeah.
That is what has happened in COVID. Congestion होना. So congestion में क्या होगा? There is no space for the air. Let us do a quick small exercise. यश मेरे साथ करो.
Okay.
Hold your breath on the count, and when you're feeling uncomfortable, release it. लेकिन I'll count 10. ठीक है?
Okay.
Let's start. 1, 2, 3, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Release it.
Yeah.
Now, the thing that you felt at the 10th second, वो मन में feeling आया ना, बाप रे कब 10 आएगा? That is what is your pet feeling every single minute if he's going through a congestive heart failure. Every breath of your pet is like that. आपको ये समझना. Let me tell you something. I told you there is no heart attack, but in dogs, basically, especially in dogs, it is a progressive heart disease. धीरे 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 बढ़ता है. ये जो बढ़ने की speed है, as it becomes older and older, the speed becomes very fast. ठीक है? So that is the reason, whatever I've explained you right now, every single pet parent in the first counseling of my cardiac patient, मेरा almost 1 hour का चलता है. As I'm done with the evaluation, I take 20 minutes to counsel my pet parents. I literally draw it on a paper, use this model. I tell them because I need my pet parents to have that kind of acceptance because they are the first eyes.
Right.
में कुछ भी changes हो रहा है तो मेरे को मेरा pet parent ही बताएगा ना, isn't that? So I need those eyes. Okay, I train them. इनका breath का उसे count करना है. आपको मुझे ना 10 दिन में एक बारी, 8 दिन में एक बारी number of breaths मुझे count करके भेजिएगा. जब वैसे सो रहा है तो भेजिएगा, खांसता है तो मुझे वीडियो भेजिएगा. Sometimes when the pet parents come to me, कोई videos नहीं है मैम वो ऐसे खांसता है. I tell them मुझे खांस के दिखाओ. मुझे खांस के दिखाओ आप. Let me tell you, this is such a crucial information. Okay, I'll just show you. If ever you come across a pet that coughs like this. This is not cough. This is a congestion in the lungs. वॉमिट के जैसा फीलिंग आना, जैसे गले में कुछ हो निकाल के फेंकने की कोशिश करना and doing it frequently. और in the night when my pet is about to lie down, करके खांसी चालू हो जाना. अचानक से खांसी आ रही है, वैसे ठीक था, सिर्फ सोते वक्त खांसी आता है. So this is a very crucial sign, a very crucial information about the heart disease. ठीक है? Only 2 kinds of heart disease and both are slow and progressive. muscle disease, valve disease. ठीक है?
Got it. Okay.
Yes.
I'm taking some time to register everything because I have seen my pets do the same thing sometimes. So
Don't
I'm
worry, it is
kind of
not
just
about
recollecting.
not about sometimes. These things happen recurrent,
Right.
very often, or sometimes it happens for a month or 2-3 महीने तक नहीं होता है. Those are the things should be alarming. Anything that is cyclic, बार-बार होना, थोड़े-थोड़े दिन बाद होना, एक particular scenario में होना, ये चीजें आपको trigger करनी चाहिए. There is something that I need to look into. Basically, these heart diseases are basically happens because of a couple of reasons.
Okay.
They happen because of the aging process.
Okay.
And second important thing is when they have high carbohydrate diets, low protein diet, or if my patient is hypothyroidic, thyroid kam ho jana, if my patient is diabetic, if my patient probably had a tick fever or going through the tick fever, the most common scenarios where you can see a compromised heart.